I go out into the community. I meet them where they're at. I discuss the needs of the community, what resources they would like.
I go to different community events throughout the city, libraries, churches, health fairs. The conversations we have is social health determinants, try to figure out where they are and what their needs are, and provide them with the resources that they need.
I came from the clinical side, so it's really good to be in the community and meeting people before they get to the emergency room.
They can sniff a fake person a mile away and they will chew you up and spit you out. So yes, you have to meet them where they're at. You have to show empathy, sympathy, and compassion. You have to be able to use your active listening skills. Listen, because that's the majority of the time what they want you to do. They really want you to hear them and understand exactly where they're coming from. Like I said, be able to put yourself in someone else's shoes.
So there's a broad scope, but in the African American community, in our community, there has been that history of mistrust. When we look at just the broad history of that, what we're doing by building relationship, by going into communities, having screenings, engaging, I feel like we're repairing the damage that has been done in an authentic way.
A long time ago, I realized that information is key, and I learned that a lot of people don't know what they have access to. I enjoy it because I get pleasure out of seeing people transition from one place to the next. I was one of those people once upon a time where not having the information that I needed, and then when it was provided to me, I seen how it changed my life. So I wanted to return to do the same for others.
The reason why the role is really important is because I get to meet people where they are out in the community. If they are at a church service, at the beauty salon, at DSS getting social services, I'm there meeting them where they are. And people need to know that healthcare is accessible to them in Baltimore City. So our job is all about networking. We're there where people are living, working, playing, right? With DSS specifically, a lot of people are going there for health insurance. And so we're meeting people after they're getting their health insurance. They know as soon as that card comes in the mail, they already have an appointment so they can get that primary care.
The partnership with DHS and GBMC, I initiated that, so I'm proud of that connection.
I'm happy to be part of our partnership with the Mac Lewis Foundation. They do a great job. Also, the BIT Center. I can't wait until we get more of those healthy eating classes. Getco Cares, oh my gosh, they feed so many at the food pantry. I mean, they have clothes, they have toiletries. So many people volunteer in the churches, and I just appreciate everything that I see. I wish I could donate more right now.
It's important because a lot of people in the city are just not taking care of their basic needs. Their basic needs aren't being met, and everyone should have access to healthcare.
The demographics of the people that we serve, it's broad, but there's a focus in Baltimore City, right? And that is substantially African American.
I think sickness and health, we just look at the humanness in people. Being human is what really connects us. So the biggest takeaway is that healthcare is for people. Healthcare, sickness doesn't discriminate. Cancer can come to the poor, it can come to the rich, it can come to the educated, it can come to the uneducated. So nobody is exempt from being sick, and everyone should have access to healthcare. That's the biggest takeaway.